Hello, my name is Lauren Carnes, and I will be discussing the pathophysiology of HIV, also known as human immunodeficiency virus. I'll first discuss the disease process of HIV. This is a virus that attacks the body's immune system. If it's not treated, it can lead to AIDS, which is also known as acquired immunodeficiency syndrome. AIDS is a final stage of HIV. HIV destroyed T cells are these cells are which protect the body from infection and disease when functioning normally. There are two classes of HIV, HIV-1, which is more common in the US and worldwide, and we have HIV-2, which is more rare and seen in Southern Asia and areas of Western Africa. The pathophysiology of HIV, or human immunodeficiency virus, the viral disease where HIV attacks helper T cells bearing the CD4 antigen, which acts as a receptor for the retrovirus, and it allows it to enter the cell. Also, macrophages is a process where foreign antigens and they present antigenic material to the T4 helper cells, which are also known as CD4. The CD4 will transfer this information to the T and B lymphocytes. I do also want to note that macrophages are a key component of the immune system. They are equipped to sense and respond to tissue invasion by infectious microorganisms or tissue injury. Once exposed, the virus will replicate by invading and destroying these CD4 in cells, also, which I mentioned before, T helper cells. HIV cannot reproduce on its own. So what it will do is it'll attach itself to the T helper cells to become one. The HIV molecule attaches to the CD4 cell, and this will go through a process called GP120. In HIV, a retroviral particle, which is the RNA strand, this is wrapped in the glycoprotein coat, which is the GP120 receptor. It wraps itself with a P24 viral protein, and this is what invades the CD4 cell. The HIV molecule needs to attach to both the CD4 cell and this cold receptor, and this is how it gets into the cell. After there is cell invasion, the HIV enzyme and gene, they're released and integrated into the lymphocytes. This is what causes the rapid reproduction, or I should say the production of the new HIV virons. Eventually, cell death of the T4 helper lymphocyte occurs, and the virus can become latent. HIV belongs to a group, as I mentioned before, called retroviruses. The retroviruses carry their genetic material as RNA rather than DNA. Cellular immunity declines as the invasion of HIV progresses. Opportunistic infections begin to emerge. Some risk factors I'd like to include are needle stick injuries, Black or Hispanic males, history of sexually transmitted disease, unprotected sex, sharing IV drug needles or syringes, mucosal contact with infected secretions, body fluids, or blood. Risk factors for HIV developing into AIDS is absence of treatment, extreme stress, poor health or nutrition, old age, genetic predisposition, having more than one infection. Some complications I'd like to discuss are fungal meningitis, TB, pneumonia, and candida infections, and also cervical cancer. Some major signs and symptoms. Within a few weeks, individual may feel flu-like symptoms. They're going to feel extreme fatigue. There's going to be some weight loss, sore throat, possibly fever, night sweats, diarrhea. Then they'll present asymptomatic with no signs or symptoms until it progresses further to AIDS. Some diagnostic testing, CD4 and CD8 counts. There also could be GI wasting through opportunistic diarrheal infections, antibodies that will be detected by resulting in positive test from the period of initial contraction. The Western blot will detect antibodies to HIV, and it's used to confirm EIA. The viral load measures HIV RNA in the blood plasma. Initially, on contracting the virus, there is a period where the test could be and will be false negative on the antibody blood test, even though the person is very infectious. There are high levels of replication and severe drops of CD4 and T cell counts. The viral load stabilizes, and then the virus is dormant until the CD4 levels drop below the 200 count, which I want to include. When the CD4 and T cell levels drop below 200, this person is considered to have AIDS. Thank you very much and have a good night.